Welcome back from the short break. You are still watching Wide Awake here on Doxa TV. My name is Berenji Stella, and right about now, I'm joined by the Dr. Lilly Muhimbise, and she is also from Adi Memorial Hospital. And this is a great journey that we are walking together with Adi Memorial. You can find them right there in Kanyanya on Bahai Road. Every single week, we are going to try as much as possible to bring you doctors from different fields and talk about different health concerns that you and I should get to know about. And that's why we are on this journey with Adi Memorial Hospital. Now, this morning, my guest is already here, but to remind you that we are streaming live on YouTube. So head over there, Doxa TV Uganda, to catch this conversation, but also share it with a friend so that no one is left behind. Good morning to you, Dr. Lilly.
Yes, good morning, Stella, and good morning to the people out there who are viewing us today. My name is Dr. Muhimbise Lilly, as I've been introduced by Stella, and I'm a medical officer at Adi Memorial Hospital. Today, I'm going to be sharing a topic that is common among women, and that is pelvic inflammatory disease.
So allow me first to say this. So when Dr. Colin told me she'll be discussing pelvic, I'm like, wait, what? I went down. I'm like, I need to understand this. Please, first things first, what is pelvic inflammatory disease?
Yes, so pelvic inflammatory disease, as the name says, it's an inflammatory condition within the pelvic organs. So it is infectious, meaning it can be spread from one person to another.
Okay.
So it is an infectious and inflammatory disorder in women affecting the upper genital tract. That includes the uterus, the fallopian tubes, and the ovaries. However, it can now spread further to other organs within the abdomen. So that is how we describe it. That is a pelvic inflammatory disease affecting women, not men.
So it's only in women and also on the upper.
On the upper.
Okay, now that is where we are going to go, because if it's on the upper, how do we know we have this?
Yes, so how we know we have this, there are certain symptoms that you're going to present with.
Okay.
So you're going to have a dull lower abdominal pain.
Okay.
So it is dull, and people tend to ignore the pain.
Yes.
Then they are going to have an abnormal vaginal discharge that is foul smelling. Actually, that is what usually brings the women to hospital.
Okay.
Apart from that, some come when they have painful sexual intercourse with their partners.
Okay.
They may have bleeding after sexual intercourse. When it is an acute or it has gone further, a patient can present with fever, nausea, vomiting, and in that state they are very sick patients. Now, the people who are usually at risk of getting those conditions, not every woman is going to get a PID.
Okay.
It is usually common in girls or ladies less than 25 years who are menstruating and are sexually active with multiple sexual partners. In particular, quote the word, multiple sexual partners. So that's the biggest risk factor to have that condition.
Okay, now let's first take a step back, because hearing all the information you've shared so far, when I look at it, it seems quite deadly. But then I'm wondering, how do we even get it? Do girls get it from men, or do we get it? I need to know all this thing. A lot is going on through my mind, because it seems to be quite deadly, and yet you say that it's something, especially in its build-up, that people can easily ignore. We don't quite catch on it so fast. So how do we get it?
So first and foremost, the major cause, 85%, is from sexual intercourse. From men, we get it from men.
Yeah.
The usual cause is usually Neisseria gonorrhea,
Okay.
mainly known as gonorrhea, or it can be by organisms like Chlamydia trachomatis. I'm trying, like, in case there is any outside any doctor watching us or any medical personnel. The other one can be Mycoplasma genitalium.
But
so
you
they are
say you're trying to explain to a doctor out there, yet for us, we don't know what
yes,
is.
so they are different organisms
Okay.
acquired through sex.
Okay.
So we get it from men. However, someone may not actually get it from men. That is the 15%.
Okay, so 15% are the ones who may not get it through sexual intercourse.
Yes.
Okay, so 85% is
Usually.
that. Okay, so what's the other 15%?
So the other 15% is by us, the ladies. During the hygiene, people tend to use soap, and then you're trying to clean yourself. So in the process, usually our private parts have, I may say, lactobacillus. Those are bacteria.
Okay.
They tend to produce acid in that environment to make sure that there is no bacteria that affects.
Yes.
So once you use that soap, and then some people do what is known as vaginal douching. They want to put and clean themselves thoroughly. In the process, you are actually making yourself sick. So it is advisable, just clean yourself normally with clean water and stop there.
Just water and then nothing. So again, cleaning is just on the outside, because on the inside it does clean itself.
It
So
cleans
I have
itself.
heard.
Yes.
Ah.
Then the other thing is actually you may go to hospital and get a PID from there. There are certain procedures that we do. For ladies who are going for family planning, we tend to insert an IUD.
Okay.
So in that process, if the procedures of a sterile process is not followed, you end up with a PID. The other procedures can be, in case you've gotten an abortion and they are doing evacuation, cleaning, in the process, infections can ascend. They go upwards. Remember we said PID is the upper.
The upper.
So
yes.
it can also progress to there. So usually those are the causes. Among the other causes, there are different things. You may have an infection just in the lower, then it keeps ascending. You may have an infection within the abdomen. We said the organs are within the abdomen. So in case you have an infection within an abdomen, it may go to the ovaries and then to the fallopian tubes. That is how usually we get infected. And
Now, I'm about to ask you a question that I think doctors hate to see coming. This is where, at home, I would want to self-diagnose. Not like diagnose, but to try to understand, probably, this is the issue that I have. Again, we shall talk a little bit if there are things that we can do at home, natural remedies. But before we get into that, I wanted to ask you, what makes PID? Again, this is pelvic inflammatory disease. What makes it different from any other infections that women are usually prone to?
now, what makes a PID different from other infections is it is slow. It's not a fast condition. It will come slowly. And people tend to just treat it from home, as you have said.
Yes.
They get some painkillers. They are having abdominal pain, and the pain goes. The infection goes on. It goes on. In the process, you get scarring. You know, when you have a wound, it heals with a scar. But because it is slow, you again get infected. You get scarring. You get infected. You get scarring. In the process, when you reach the childbearing age, you want to get pregnant, you are unable to bear, something known as infertility. Or even when you get pregnant, you get a condition known as ectopic pregnancy.
Okay.
That is, because of the scarring, there is no that regular movement of the ovary and the ovum that has been fertilized to go to the uterus. In the process, the pregnancy grows within the tubes. That is the ectopic pregnancy.
Because already up there, that's where the issue is. Okay. Oh, wow. Now we get into natural remedies. I know doctors really do not like it, but why I want it, and I think I should first take you back to where we use soaps, or where women use other things to clean. There are others who even insert things for sexual pleasure and things like that. Is there a way to have our intimate parts go back to their original acidity or alkalinity, whatever conditions, the original conditions that need to be there? Is there a way that we can have it, even when we have done some of these mistakes? Is there a way to restore it back to what it was?
Yes, so for the people watching us, naturally how you can prevent a PID, I will say, what you can do at home without going to hospital is, one, we are going to avoid using soap.
Okay.
2, you're going to maintain your general cleanliness. You can do the cleanness morning, evening. 3, yogurt.
Okay.
But the yogurt we encourage, take it orally. Some tend to
put it there.
Yes. Some people actually have a myth of they put garlic. They are trying to kill those organisms that have overgrown. But we encourage, leave everything natural. Everything cleans itself naturally. Just clean yourself normally with normal water, and then we encourage taking yogurt because it helps in the growth of the normal flora, the one that creates the acidic pH.
Yes.
So do not put anything.
So any yogurt or the unsweetened one?
Any yogurt.
Okay.
Because they have that component of yeast and
yeah, because oftentimes we hear the unsweetened one and people want, they have a sweet tooth and they want, to have some of that. Okay, so how we feed anywhere whatsoever an effect to our condition out?
No, feeding is not related to PID.
Okay.
You just feed normally. The only thing we encourage is you to take that yogurt because it helps in that pH, the bacteria growth, the normal flora. It's what we encourage. Diet, we don't usually limit, take this or take that.
Okay. Again, we are concentrating on PID, not other not other conditions, because there are conditions that actually grow because of your lifestyle and what you are feeding on. Now we have to go for a very short break. When we return, we are going to be telling you what you have to look out for when you go for treatment in hospital. How is it treated? That way you can know that, with this sample that is being taken, I'm going to be tested for this, and this is how they're going to be treating it. So we go for a short break, very tiny. We return with Dr. Lilly here from Adi Memorial Hospital. So please do not go away. you so much for still keeping it Doxa TV UG right here on Wide Awake. This is Health Wednesdays, and we have Dr. Lilly Muhimbise with us from Adi Memorial Hospital. We are talking PID, and if you just joined us right now, that is a pelvic inflammatory disease which mainly affects women. Now, right about now, we get into how is PID diagnosed.
Yes. So PID, we do two things to diagnose PID.
Okay.
First, we examine you. Second, we do laboratory or imaging investigations.
Okay.
So during the examination, we shall do a VE, known as a vaginal examination,
Okay.
where a patient will present with cervical tenderness. When you touch on the cervix, the patient will feel too much pain. Or we do an abdominal exam, you feel lower abdominal tenderness.
Okay.
Or you may have adnexal tenderness. Remember, the ovaries are in the sides. So when the doctor touches in the sides, there is that tenderness that is felt by the patient.
Okay.
The other thing we do is something called caldocentesis, where we get a needle, put it in the posterior fornix within the canal.
What is that?
So it is an examination we are trying to do. Usually at emergency, someone has come, is in severe pain. We don't have time to do the investigations.
Okay.
So we just get a spinal needle, put it on a syringe, and pull the fluid that usually collects.
From where? From the spine?
No, from the vaginal canal. We go to the posterior fornix, the real behind posterior part. So we put a needle in some sac. It's called the cul-de-sac. So when you pull, the fluid is purulent. It is strawberry colored. So that is how.
Doctor, please do not destroy strawberries for us
Yes.
this morning.
So that is how we can make a diagnosis, by just examining. So however, we can go further and do investigations. We take your blood, take it to the lab, and do a complete blood count, or a CBC, to check how the infection has traveled to the bloodstream.
Now, that is what I wanted to ask you, that because it is on the upper side, does that mean it cannot show in urine or blood? But you have answered about it, but you haven't mentioned urine. So with PID, no urine is taken?
Actually, that is a very important point. A patient will come presenting with painful urination.
Okay.
But when you pick a urine sample, there is no infection within urine. That will raise a big suspicion of it's a PID. Yes.
Okay.
So the other investigation we usually tend to do is make sure you rule out pregnancy. Because once you're pregnant, you have a PID, it means you need to be admitted.
Wow.
Or it may be an ectopic pregnancy, because we said it is a big risk when you have PID. So it is important when you come, we do an HCG to rule out pregnancy. Yes.
Okay, now I wanted to ask you, is there a way to catch pregnancy, to know earlier on that it's going the wrong way, or it's not in the right position?
Yes.
There are ways to do that? Okay.
So the other way we can do that is doing an ultrasound scan. So if we have checked in urine or in blood, because pregnancy can be checked with two investigations, either blood or urine.
Okay.
But blood tends to detect it earlier. So when we find out you have the pregnancy, then we do an ultrasound scan to find the location of the pregnancy. If it is in the tubes and has really grown, we advise go for an operation before it breaks the tubes and you end up losing the whole tube. Yes, so that is what you advise. The other imaging investigations that we do, we can do a transvaginal ultrasound scan.
That is that. It seems so.
Yes, it is still the other invasive that may predispose you at a risk of a PID. But when done in a right way, then the risk is reduced. So it can also help us to say there is a PID. What they usually see when they do a scan, they're going to find your tubes have enlarged in size because they are inflamed. They're going to find there is fluid that collects, because usually when there is inflammation, there is fluid collection. So that is what they usually base on to say this one has a PID. The other investigation they do, and they say it is the gold standard. Usually it is the best investigation.
Okay.
It is something known as a laparoscopy.
And what is that?
So with the laparoscopy, there are certain machines. They will create some holes on the abdomen, and then they view inside. They see the whole, like it is an on-time view. You're seeing exactly what is taking place.
What is happening
It's
inside.
like a video, I may say. So that one, it is usually what confirms and tells you this is a
That
PID.
this is what is happening. But when you say holes, that means there's cutting and...
Very tiny, small, very small.
Ah.
And then the camera goes in and views. Of course, the camera, it is also very small, but
tiny.
it tends to make the images larger, so
Okay.
you can easily see, and they make a diagnosis of a PID.
Earlier on, when you were giving us some of the causes or where someone can contract the disease, you mentioned where there is installation of the IUD, and I had a question, but it had briefly skipped my mind, and I wanted to ask you, if in that process you get infected, once you treat it, can't the treatment affect the IUD, or there is no condition whatsoever in regards to condition that can affect the, how should I say, the power of the IUD or any family planning method you could be using?
So when we've put up an IUD, we usually advise in the first 1 month, monitor for any signs.
Okay.
When you have them, go to hospital, get some antibiotics, and then that is it. An IUD is not affected, its effectiveness still remains the same.
All right.
And the more you have an IUD, the lesser the chances of getting a PID. So if I put a PID today, the next month,
IUD rather.
an IUD, the next month, 4 months have passed, you've not gotten a PID, your risk of getting a PID is almost at 0%. So the longer the stay, the less. So that's why we tell them we shall monitor you in the first 1 month. Yes.
Now, I want to know, we have heard it a lot that our bodies, God created us, our bodies can be able to fight some of these infections and diseases. Now, is it the same with PID? Can our bodies really, if we do not come for treatment, and what are some of the effects that could happen if PID is untreated?
Good. So, with PID, we encourage treatment. It's not like the body is going to fight. Remember the organisms we mentioned in the start?
Yes.
The sexually transmitted, those infections, they tend to be rapid. So there is nothing like natural remedy or the body is going to fight against. It is important you go to hospital.
Okay.
And that treatment usually lasts 2 weeks. So you tend to go to the pharmacy and then get some treatment for 4-5 days. You get better and then that's it. But a PID is treated for 2 weeks. 2 weeks. So when it is treated and then you're followed up, then you know that the PID has cured. You're avoiding the other complications of failing to treat. Among the complications, we said infertility, ectopic pregnancy. You may actually end up forming an abscess. Pus collects within your ovary, within the tubes, and then it means now you're going to end up being operated for a condition that you would have gone to hospital. It's diagnosed, treated for the 2 weeks, and that is it.
Yeah. Okay, as we wrap up, what are the treatments that are available for PID for the person who is watching us this morning?
Yes, for the treatment, we treat with 3 goals.
Okay.
1, we want to make sure you get relief, you're in pain. 2, we want to eradicate the bacteria that have caused the infection. We want to make sure those bacteria are gone. 3, we want to avoid complications that we have mentioned.
Okay.
When we are treating you, we can manage you as an outpatient or an inpatient. Outpatient, we just give you oral medications. You take them home for 2 weeks.
Yes.
But when we give you that medication to take home for 2 weeks, within 72 hours, we follow up. You should have gotten a great improvement.
Okay.
So in 72 hours, if there is no improvement, come back to hospital, because there are other conditions which mimic a PID, and when you just stay home for 2 weeks, you come when those conditions have actually worsened. So we tend to follow up our patients for the first 72 hours.
Okay.
Or we can actually admit you, give you some intravenous medications, put a cannula, give you medications. When we feel like you are better now, we can manage you from outside the hospital. Then we manage you as an outpatient.
Okay. I like that. Well, too much to take in, but it's just the information that we need. Now, Dr. Lilly, any last information you want to leave with the lady watching us this morning, especially on the topic of PID?
Yes, to sum up the topic, PID, majorly sexually transmitted. Ladies, we seek medical help often,
Yes.
but our partners tend not to seek the medical help. As you're treating yourself, remember to treat your partner. Let him go to hospital and also get treated to avoid those long-term complications. Whenever you feel small abdominal pain, dull, constant, please seek medical help before you get the complications. When you reach the childbearing age, you cannot bear just because of a PID that could have been treated prior.
Thank you so much, Dr. Lilly. I've learned a lot myself, and we also want to thank Adi Memorial Hospital for walking this journey with us in bettering our lives as Ugandans here on Wide Awake by sending us all these great conversations and diseases at that we should be aware of and how to go about them. It marks the end of this discussion, but the show is still going. We shall be having sports with the Dickens back here on set in a bit after the break.